If you've torn a muscle, destroyed your gut, or you're just not recovering the way that you used to, there's a peptide that scientists have been quietly studying for decades, and it might just be worth your attention. It's called BPC-157. And over the next 10 minutes, I'm gonna run you guys through what this actually is, what the research says it can do, whether it's safe, and how people are actually using it. I'm Jack Cooper, head coach at JCF Coaching, where we help everyday Australians with their fat loss, muscle building, training performance, and recovery, all through our comprehensive app online. Now, this is a topic that comes up almost more than anything else, so let's get into it. That was me 6 weeks ago, grade 2 calf tear. Now, for anyone who's torn their calf before, you know you're not walking away from that. You're certainly not training. If you're a parent or your job requires you to simply just move around, it's a problem. What I did here was immediately implemented BPC-157, TB500, and GHK-Cu, a peptide stack specifically for soft tissue repair, inflammation, and collagen regeneration. Guys, 14 days later, and I was back to doing calf raises, training as per normal, and running around. Now, being completely upfront with you guys, this is my personal experience. It's not a clinical trial, and I'm not saying that what happened for me or the rate of my recovery is what's gonna happen for you. But the reason I wanted to put this video together is when I look at the research, what actually happened to me aligned exactly with what the science is saying. Now look, today's specifically about BPC-157, but if you guys wanted to know more about the other two peptides and why the three of them synergistically work so well together, let me know in the comments and I will do a video on that next. What is BPC-157? BPC stands for Body Protective Compound, and the 157 refers to the exact sequence of amino acids it's made out of, which is 15. Now, it is a synthetic peptide, meaning that it's actually made in a lab. However, it's made based on a protein that is naturally found in the stomach. So I want you to think of it like this. The body or the stomach already produces a similar compound to protect itself, and scientists have just gone ahead and isolated that sequence, replicated it, and then thought, what else can this do in the body? Now, the research goes back to the early 1990s, and at current, we have roughly or just over 180 peer reviews, with a lot of them being animal-based. We don't currently have a lot of human data, which is actually really important for us to know. So there's 5 really interesting abilities that BPC has shown in the rat studies so far. Number 1 being support mood and brain function. So there's evidence that's emerged that shows interactions with both dopamine and the serotonin pathways, which makes sense when we've seen some reports from people of improved mood, reduced anxiety. Number 2, gut repair, lining, and GI tract. This is actually its original function. It's been shown to help with gut inflammation, leaky gut, and even conditions like IBS. Number 3, reduced inflammation across multiple tissue types. So that's muscle, bone, and nerve. Number 4, accelerate tendon and ligament healing. Now, this is the most common one, and rat studies showed significantly faster healing in Achilles tendon rupture compared to controls. So this is a really common one that a lot of people are using it for, tendonitis. So whether it be golfer's elbow, tennis elbow, you know, it can be, you might have rolled your ankle and had a slight ligament tear. So this one here is what most people are heavily focusing on and utilizing it as a tool for. Now, number 5, which is a lot less common, but there has been some studies that have showed some nerve regeneration or repair, right? Only very few studies are showing that, so it's not something that we are commonly using it for at the moment, but hopefully as these human control trials continue to expand, we get a little bit more information on the nerve regeneration. Most of this is preclinical, meaning rat and cell. We don't have a large scale of human trials just yet, but what we do have is a small number of human case studies, and they are promising. In 2004, a pilot study showed 80 to 100% symptom resolution in 12 patients who had interstitial cysts using BPC-157 bladder injections. And a separate study on knee pain showed 87.5% of patients reporting significant relief 6 to 12 months after injection. Now, if you're watching this and you're dealing with a nagging injury, slow recovery, or you've just hit a bit of a wall with your body compositional changes, this is exactly the stuff that we work through with our clients online here at JCF Coaching. We've got coaches who understand training performance, fat loss, recovery, and they will work with you one-on-one in great detail. If that's you, I've left a link in the bio for you to click and book a call with me today, or alternatively head to jcfcoaching.com.au and you can either inquire or book a call there. Absolutely no pressure. We'll just jump on, have a chat about where you're at and how we may be able to circumnavigate that together. All right, back to BPC-157. All right, the mechanism. Now, what does it actually do? I'm going to keep this pretty simple. BPC-157 works through a few different pathways. Firstly, angiogenesis, where it promotes formation of new blood vessels, meaning more blood flow to the damaged tissue equals faster healing. Think of it like redirecting the repair crew to the job site. Number two, nitric oxide regulation. It influences nitric oxide pathways which affect inflammation and blood flow. Number three, growth factor interaction. Now, it appears to upregulate certain growth factor receptors, which means that the body is essentially going to respond more efficiently to its own repair and recovery signals. And number four, the gut-brain axis. Now, there is emerging evidence of its link or interaction with serotonin and dopamine pathways, which actually aligns with some of the anecdotal reports that have been received of people feeling improvements in mood and reduction in anxiety when utilizing BPC-157. All right, now the big question, is BPC-157 safe? Now, there has been hundreds and hundreds of animal studies which have reported absolutely no adverse effects whatsoever. All the safety data that we do have in human beings is limited. What we have is completely clean. A 2025 study administered 20 milligrams into 2 very healthy adults with absolutely no adverse effects, no changes in vitals, blood work, ECGs, thyroid function. But with that said, we just don't have the long-term data in humans just yet. We don't have large randomized control trials, and there actually is one theoretical concern worth mentioning when it comes to BPC-157. Because BPC promotes angiogenesis and new blood vessel growth, there is a hypothetical question that, in theory, it could support tumor growth. Now, this is not something that we have observed in the animal studies. However, it is something that the scientists and researchers are trying to find out properly in humans. When it comes to a safety rating for BPC-157, I would personally give it a 3.5 out of 5 on the scale. And not because it's showing harm, but because we simply just don't have enough data or human data yet to give it a 5. Dosing and application. Right, now this is purely based upon what appears in research and what is commonly getting reported. So we see most research starting between 250 to 500 mcg per day. Now that is micrograms, not milligrams or not mil. mcg is micrograms. We're gonna be administering subcutaneous or sub-Q, which means just under the skin. Again, this is educational context only, so please make sure you go ahead and speak to your GP. And for me personally, when I was utilizing the BPC, the TB500 and the GHKCU, I was utilizing 250 mcg per day. All right, now for those of you who are already on this journey, let's talk about reconstitution, because it's something that actually trips up a lot of people. Now, as you can see, the BPC is going to come in lyophilized powder, which is essentially a freezed form. So it is going to need to be reconstituted with bacteriostatic water. We have a 10 milligram vial. So let's do the maths first. 10 milligrams equals 10,000 mcg. Now, because I personally utilized 250 mcg per day, I'm gonna work out my reconstitution for 250 mcg per day. So my dose is going to be 250 mcg per day. So in this 10 milligram vial, utilizing 250 mcg per day, we're actually gonna get 40 total doses out of that. Now, in order to achieve that, we're gonna need to add 2 ml of backwater. Once we've added that, we need to draw 5 units in our insulin syringe in order to get 250 mcg. Now just for a quick reference, an insulin syringe has 100 units, and that 100 units equates to 1 mil. So I'm going to be drawing out of a 3 mil barrel. However, if you're only drawing out of an insulin syringe, in order to get 2 mil of backwater out, you're going to need to draw out 100 units twice and obviously put it in. All right guys, now let's land this plane. BPC-157 is one of the most studied peptides in preclinical science. The animal data is impressive, the early human data is promising, the safety profile in animals is clean, and the limited human trials show absolutely no adverse effects. But we obviously do need more human research, and it's really important to note that it is not TGA approved here in Australia, which means it actually does require a prescription for use unless you are purchasing for research purposes only. WADA has also banned it for competitive athletes, so if you do compete naturally, of course, and you're wanting to utilize supplements, BPC-157 is not the one for you. It is on the banned list. However, if you are dealing with chronic injury, gut health, or just really slow recovery, it certainly is worth having a conversation with your general practitioner about. And if you're serious about your fat loss, your recovery, your long-term health, that is exactly what we do here at JCF Coaching on the JCF Coaching app. We have a team of coaches who build individualized programs for real people with real lives. As I mentioned earlier, if you want to know more, guys, click the link in the bio. You can book a call with me today, or just head to the jcfcoaching.com.au website. You can either inquire or book a call through there as well. Don't forget to hit the subscribe button if you're wanting to learn more about peptides and what's to come, because it is going to be a very, very exciting future. You can also follow me on Instagram at jackcooperfitness_. And if you are utilizing BPC-157, guys, drop a comment below. I'm very interested to hear your experience and how it's worked for you. Till next time.